that everyone exercise social distancing. We've heard this term. I was on a conference call this morning, and I think I finally understand this 6 feet width. What the doctor from Emory said is that the projectile cannot exceed 5 feet. So if we can maintain this 6 feet distance, but this term social distancing also includes repeatedly washing your hands thoroughly with soap and water throughout the day. And also, if you can stay at home and work, even if you are in a business that's allowed to operate, to stay at home and work, please. We are working through this as best we can. The shelter-in-place order, I think, was a positive step, but other things have come to our attention in recent days. Our surrounding counties, we all know thousands of people come into Albany every day to work and shop. Well, county lines are really nothing more than a place in the sand. This virus is totally indifferent to county boundaries. So if people are coming into Albany to shop and work, there have to be precautions taken in our surrounding counties. And fortunately, there's a conference call scheduled in the morning with elected officials in several counties. I guess Chairman Cohilas can identify those counties. I hope they all will participate. But I think the governor will also be on the line, and we are requesting that counties in surrounding areas take precautions. But we're also encouraging citizens in surrounding counties to implement and exercise these precautions which you hear are in place for the people of Dougherty County. We hear reports every day from Phoebe Putney. We know this. The hospital is reaching its capacity. So again, if you have the symptoms, do not go to the emergency room. Phoebe has the hotline number. Phoebe now has the drive-through facility for testing. Okay, let me give you some positive news. I think we're going to be getting some more personal protective equipment for healthcare providers. There are new testing procedures. We've all heard about them. Possibly the testing can be done at some time in the near future where the test can be administered and we'll have the results at the hospital within an hour or so. But the healthcare professionals can talk to you about this. I want to commend everybody who's cooperating, but I also want to, again, tell people, particularly young folks, don't be a knucklehead. I know what you want to do. You're bored. We're hearing about people going and congregating in parks. Please don't do this, because young people, you can have the virus and not have any symptoms. But if you go home and you're around grandparents, you could actually infect them, and their consequences for your loved ones could be potentially catastrophic. I want to also recognize Mr. Blackwell, who's working with our homeless community. We're taking some procedures there to protect those folks who, many of whom might not exercise the precautions that they should, to protect them, but also to let everyone know. We understand there has been a confirmed case in a retirement home, a nursing home. Please know, if you have a loved one in a retirement home, my father lives in an assisted living home, that these restrictions are particularly important in those type of facilities because the residents are most susceptible to this virus. And with that, I thank you, and please bear with us. We'll work through this and we'll get through it together. Thank you and God bless.
Thank you, Maduro. I'd like to bring up now Chairman Christopher Cohilas, the Chairman of the Dougherty County Commission, for some comments. Mr. Chairman.
Thank you, Chief Scott. Thank you, Mayor. A couple of items that I want to hit today. One, I want to thank the community for its hard work in complying with the shelter-in-place order, which was issued by myself and Mayor Dura, and which was issued after a lot of thought, a lot of contemplation, and a lot of consideration. None of us wants to issue this order or wanted to issue this order. Liberty is something that's important. Our businesses are something that is important, but we have been provided with a significant amount of very learned medical advice. In fact, I attended a webinar this morning that was hosted by one of the most renowned epidemiologists from Emory University, where we literally got to see the progression and the different models of what COVID-19 can do to our community, our state, our region of the country, and the country as a whole. And it's very necessary that we take swift and decisive action. I want to thank the public in particular for making sure that it complied with our request. While we don't have 100% compliance at this time, the amount of traffic that was out there, the amount of people that were engaging in activities that was prohibited went down significantly yesterday. What I can say to the community is this: your investment now, and I recognize that it is painful right now. I recognize it's painful for businesses, it's painful for families, it's painful for everyone. But the pain that we suffer now is an investment in our recovery later. That is very, very important for everyone to understand. And if we do not have compliance now, and we don't make that investment now, that is painful, if we don't make that investment now, we will end up in a position where we have to bring in even greater restrictions that are far more restrictive on businesses. But thank you. I want to continue to see the level of compliance and beyond that we have currently seen. I thank all of our business owners. I thank all of our citizens for trying to take that to heart and do what they can. I echo the mayor's words, like there's going to be a learning curve as we move through the next 2 weeks, and there are certain activities that we don't need to be engaging in. We don't need large groups of kids playing, basketball games with 10 to 20 to 30 people, or touch football or what have you, because that just puts people in contact with each other. They're exchanging coughs, sneezes, hugs, tackles, what have you, and they're spreading germs. And right now, what we know about this disease is it is an incredibly infectious disease, and when it is spread quickly within a community, it can be devastating. We have taken very swift and decisive action. One of the things that I wanted to do was to make sure that we notified each and every person that was discharged from Phoebe that is suspected of having the COVID virus. We wanted to provide them with information so that they understand what their obligations are, not only to themselves, but to their family members and to their community members. And that is meant to be an educational piece, but also an enforcement piece, so that each person that is suspected of having the COVID virus literally has the education put into their hands so that they know what they are required to do. Additionally, we have been very fortunate in having cooperation and investment from the state of Georgia. I've been in direct contact with the Department of Public Health Director, Dr. Toomey, and we have and will be having on site here in Albany and Dougherty County a special quarantine facility that can house up to 60 different people who are required to self-isolate following assessment at Phoebe Putney Memorial Hospital. As that information comes in and we have the program completely developed, we will roll that out at an additional press conference. Again, I remind our citizens to heed our call for compliance. I've gotten the many calls from businesses asking questions. I've gotten many calls from citizens who want to report prohibited activity. What I would encourage everyone to do is call the non-emergency number at 229-431-2132 to report violations of the ordinance. If we work together as a community, we can make sure that everyone complies. Additionally, it was very important that we engage our regional partners. You heard Mayor Dura say this. I've said this as well. Look, the surrounding counties, the majority of their citizens often work here in Albany and Dougherty County. They come here, they stay here. And in fact, I want to dispel the myth that the only place where this virus is in Dougherty County, because that's not true. We know it's across Southwest Georgia. We happen to treat many of the patients in Southwest Georgia here in Albany and Dougherty County because we are blessed to have a healthcare system that can address these types of issues, and it has had a strain placed upon it. We are working regionally with our local mayors and county commission chairmen to share information and share resources and knowledge that we have gained from our partnership with the state and our other federal partners as well, in an effort to try and tackle this in a regional and collaborative way so that it's not just something that stops at our borders. Additionally, we're all going to be looking looking for direction from the governor, as I understand that he will be having a press conference today with an announcement of some sort, as he is flanked by his team members that are part of his COVID-19 task force. I do want to thank the governor's office for his consistent engagement with our community, being responsive to my personal requests on behalf of the community, as well as the requests that have come from elsewhere in our community. He has made many resources available to us that have been much needed, and I do want to thank the governor for that. Thank you. Oh, sorry, one last thing I wanted to hit. Additionally, for our businesses that are still open, that have been deemed to be essential services, please do try and find ways to, within your business, make sure that people are keeping 6 feet away from each other. Try and think of creative ways, not to just do the bare minimum, but in ways that you, because you are an essential business and you are having to host the public, that you can continue to be a good partner with us during this process, making sure that people can access hand sanitizer, that customers aren't piling up on each other in big lines, controlling the crowds within your stores. That's very, very important. Thank you.
Thank you, Mr. Chairman. Before we bring up Dr. Black, I will mention that Mr. Scott Steiner is here, President and CEO of Phoebe Putney Health Systems, and he will be available for questions at the end of the press conference. But I'd like to ask Dr. James Black, who is the chairman of the emergency department at Phoebe Putney Memorial Hospital, to come up and provide a report. Dr. Black.
Thank you and good afternoon. I'd like to report our numbers as updated noon today. Total number of positive tests we've had across the health system. This includes all 4 of our hospitals and our outpatient clinics. The total number is 125. The number of negative tests is 116, and the number that we're still waiting on the results from is 679. Across the health system, again, including all of our hospitals, we had a total of 8 deaths. Our drive-through screening continues to be very popular. Over the last 24 hours, we fielded 221 calls, bringing our total up to 2,848, and that was through noon today. And we've had drive-through screenings, over 400 screenings so far through the drive-through process. So been very helpful for the community and very helpful for us as well. I'd like to just take a couple of seconds to dispel some of the things that I've been hearing from friends on Facebook. I'm not on Facebook that often, but people have told me they have questions about it. Number one, COVID-19 is not a disease of any particular race. Someone stated that they heard that African Americans would not get COVID-19. That is absolutely not true. I've also heard that COVID-19 is a disease solely of the elderly. I will tell you that in Georgia, as of today at noon, 59% of the cases of COVID-19 occur in the ages between 18 and 59. That is more than half. All right, 36% of those cases are in people of the age 60, and there about 1% occur in the ages below 18. So kids are not exempt. African Americans are not exempt. Women are not exempt. It's about split 50-50. Men are not exempt. Everyone is susceptible to this disease. This is why we are advocating social distancing. Thank you very much.
Thank you, Dr. Black. Now we'd like to have an update from our public health perspective. We will ask Dr. Charles Ruiz, who is the director of the Southwest Georgia Public Health District, to come up for some remarks. Dr. Ruiz.
Thank you, Chief. I would like to report some numbers to you, and before I do, I want to just call attention to the fact that day after day, I report on numbers related to public health. Our coroner reports on numbers that I believe are related to Dougherty County. Phoebe reports, as Dr. Black just said, I think the term he used was the Phoebe system, which includes multiple campuses, multiple locations. And the coroner, I think, has said before that when he's reporting on things that happen here in Dougherty County. In public health, we have 14 counties in southwest Georgia, so it could appear that there's a discrepancy sometimes. I think most often that's going to be explained by the fact that we have different geographical jurisdictions, if you will. So they're really not contraindications, it just depends on your viewpoint. So for the public health numbers outside of Dougherty County, we have had 6 official reports of death attributed to the COVID-19 virus. We have 2 in Terrell, 1 in Early, 1 in Lee, 1 in Mitchell, 1 in Baker. So these are the counties of residence for all of these people who are deceased. And I might say one or two more words about that. We have the 14 counties, and we have had cases, at least 2, where people who live in our health district were hospitalized outside of the state of Georgia. And so there's other potential for misunderstandings. And there's also frequently the potential that information won't flow as quickly as we would like it to. We would all like real-time information, and we're working to try to get reports in and then turn them back around as soon as we possibly can. But you can see that sometimes there are circumstances that may cause a little bit of a delay as we report. But our goal is to be as transparent as possible and to report the findings as clearly and as quickly as we can. I would like to say a word or two about the distinctions between the words quarantine and isolation. Perhaps they might be defined differently in a different time, in a different setting, but from the medical side, let me say a little bit about that. When we're talking about people who are on isolation, primarily we're talking about people who are sick. They are they're exhibiting symptoms that are consistent with COVID-19 virus, signs and or symptoms consistent with COVID-19 virus, or they have been tested and confirmed to have the COVID-19 virus. So isolation generally refers to people who have had significant symptoms. And what we're doing there is we're trying to contain the virus by limiting the movement of that person and by limiting who they come into contact with. We're trying to sort of corner off that individual until they have reached a state where they are no longer contagious to other individuals. And currently, the way we look at that is if a person with COVID-19 virus gets beyond all symptoms, fever, respiratory symptoms, all symptoms, for 72 consecutive hours without taking in any fever-lowering agents, then we would consider that person ready to release from isolation. So again, isolation involves people who have exhibited symptoms and or have been tested positive. To the contrary, quarantining is something we do for people who have not exhibited symptoms. These are people who have likely been exposed to a case of COVID-19, and because we don't have the crystal ball, we don't know if they're going to become sick or not. But we are convinced that if they're going to become sick, they will do so within 14 days. So if an asymptomatic person has been exposed to someone that has the illness, what we're saying is for 14 days, we want you to, if possible, stay at home, stay by yourself, monitor your symptoms, including your temperature. If you develop symptoms, then we want you to consult with a medical professional and let them help to determine whether or not you need to be tested or whether or not you might need to come in for a face-to-face visit. So those would be the main differences in quarantining and isolation. As it was stated earlier, most everybody is really making a very admirable effort to follow the recommendation for social distancing. Occasionally, we see people who just don't seem to be quite following the advice. Within an hour or so, I believe that I will have a signed copy of an administrative order that comes from the State Department of Public Health and will be signed by the Commissioner of Public Health, Dr. Kathleen Toomey. In this administrative order, it will outline the fact that people who have been advised to follow quarantining recommendations or isolation, if they fail to do so, they could be cited for a misdemeanor. So I hope to have the details on that certainly no later than tomorrow's press conference. And as a part, I just want to say that if you paid any attention at all, it's pretty obvious that this community is blessed by a great hospital. The folks at Phoebe Putney Memorial are doing an outstanding job in the face of mounting adversity. They're working hard, they're serving with compassion, they're serving with sacrifice, and this community is really fortunate to have them here. Thank you very much.
Thank you, Dr. Ruiz. I'd like to ask to come up for some comments and remarks, Dougherty County Coroner, Mr. Michael Fowler. Mr. Fowler.
Good evening. As Dr. Lewis just explained, sometimes the numbers kind of confusing, but the Dougherty County residents that have died here in the city is 7. We have 7 that live here in Dougherty County that have died. We have 8 that died in the resident is pending the records, the test results. So we have 7 Dougherty County residents, whether they died at Phoebe or the nursing home or died at home. We have 7, and we have 8 pending the test of the results. Then we'll have that as soon as the tests come in. Thank you.
Thank you, Mr. Fowler. And our final speaker today is Barbara Rivera Holmes, who is the President and CEO of the Albany Area Chamber of Commerce.
Good afternoon. Again, Barbara Rivera Holmes, President and CEO of the Albany Area Chamber of Commerce. Our business community is not just a partner in protecting public health and all of the work that we're doing. It's a leader in protecting public health, and I'm so proud of our business community and the proactive steps that they took weeks ago to ensure public health, to ensure the health of their workforce, and to ensure the protection of their businesses. We continue to see an incredible response from the business community in modifying operations to continue to provide the essential goods and services that all of us need. If you are a business, I'm saying thank you. Thank you for what you're doing. I also want to thank the public for the incredible outreach and support that they have shown in protecting our businesses in the way that's appropriate. We have seen so much support for this, and the continuance of commerce to flow through our community in compliance with the orders is absolutely important for our long-term economic impact and our long-term economic recovery. This is a difficult time for everyone, and we're all navigating in a very fluid environment, making decisions as they need to be made and updating our business partners and the public with the best information that we have available. Business resources for employers are available at albanyga.com and also on Facebook if you follow the Albany Area Chamber. We're encouraging all of our business to continue to communicate with your audience, let them know how you're still operating, how they can work with you, and how we can continue to flow commerce through our community. The Albany Area Chamber of Commerce tomorrow is convening all of the chambers of commerce in Southwest Georgia so that together we can create an actionable plan to get ahead of economic recovery down the line. We can do so much more together. We know that we work as a team, and I'm calling on all of our businesses in this region to take the steps to ensure public health, the health of your workforce, and the health of our economy. We continue to work very closely on the COVID-19 task force as we're looking at ways to protect our people and our businesses. I want to thank the mayor, the chairman, and all of our partners on this task force for the relentless work that is being done to protect all of us. We also have many of our industrial and business partners who are donating much of the equipment that is needed by medical professionals. Please and thank you, continue to do that. If you are one of our businesses and you have resources that may be of benefit to our medical professionals as they do this work, please contact us at the Albany Area Chamber and let us know, and we'll connect you with our medical professionals. I encourage everyone to stay vigilant, to continue to heed the orders that are in place, and to continue to support each other. One of the most important parts during this is not only to follow the guidance of our public health and elected officials, it's also to support each other. This is a difficult time, and so I encourage you to reach out to your friends, to your businesses, and just know we'll get through it together and only together. Thank you for your commitment to this area, and we're proud to be your Albany Area Chamber of Commerce.
Thank you very much for your comments, and I want to thank all of our speakers today for being here and joining us at this daily press conference. We plan to be back again on tomorrow at 1 p.m. And just a couple of items of note: we will allow about 5 minutes of questions today. But before we do that, I want to remind you of two numbers. The Phoebe COVID hotline number at 229-312-1919. That's 229-312-1919. That is the hotline that Phoebe has set up, and please make note of that. Also, we've given out a lot of information today. This number, as well as numbers to other resources that may be available. We would encourage everyone to, if you have questions of that nature, please call the Emergency Operations Center at 302-1900. It's 302-1900 to get you en route to those resources and answer many of the questions that we've heard that have came up, such as businesses being open, how to interpret the ordinance, where to find the ordinance, those kinds of things. Again, the 911 is not the number to call to ask about testing, and so please route those numbers that way. At this time, I'd like to provide an opportunity now for about 5 minutes of questions. I did mention that Mr. Steiner is here as well for questions, and we'll open up at this time. Any questions? Okay, hearing none, thank you very much for being here, and we'll be back tomorrow at 1 p.m. Have a great day.